A 21-year-old BC man has died after contracting rabies from a bat. He is just the 25th known death from the virus since record-keeping began in this country about 100 years ago. Our Mira Baines fills us in.
BC's provincial health officer has confirmed he died from rabies. It's a virus that affects the brain and nervous system and causes paralysis of the throat muscles. Health officials say the young man came into contact with the bat in mid-May on Vancouver Island. He started showing symptoms 6 weeks later, and it quickly progressed. People who come into direct contact with a bat are being told to wash themselves with soap and water and get medical help. Bats are the only known animals that carry the rabies virus in BC. Dr. Bonnie Henry says it wasn't immediately clear what the patient was suffering from.
So you tend to get pain and weakness and nerve pain that spreads into the central nervous system in the brain. Other things that are really characteristic of rabies are an aversion to water and lots of saliva production. So it's a terrible disease and is almost universally fatal.
She says even if people don't have obvious scratches or bites, their skin still may have been punctured if they made contact with a bat. Healthcare providers may have a rabies vaccine that could be used to prevent infection. But if rabies isn't treated in time, it can prove fatal, as it was in this case. Mira Baines, CBC News, Vancouver.
Well, in Mira's story, you saw there BC's provincial health officer, Dr. Bonnie Henry, and she joins us right now from Victoria. And Dr. Henry, thank you for joining us because we do want to continue this conversation. A couple of things that Mira laid out in her story, but before we get to that, let's begin with the young man who's at the center of this story. What do we know about him?
Well, this is clearly a tragedy and a very rare instance and a tragedy for his family and his community. So they are dealing with that.
They are dealing with that, and yet he was exposed 6 weeks before he died?
Absolutely, and that's not unusual for rabies. There's what we call an incubation period, the period from when somebody's been exposed to the virus to when infection starts and the symptom starts. It can be many months, and that's one of the tricky things about this disease because people may not associate the early symptoms with the exposure that they might have had months or weeks ago.
And what would those early symptoms be?
Well, in a case where somebody, usually there's pain and tingling around the area where the contact was made, and then that spreads through the nerves and can cause weakness, and then often there's symptoms like fever and headache, and early on those can be very much like other things, and people may not associate it with a contact, and especially contacts with bats, as we've heard, there may not be a visible puncture wound or a scratch. It can be even microscopic, or a bat can come in contact with your saliva, your mucous membranes, either in your mouth or your eyes, and those can be enough that the virus can be transferred into the body as well.
So even a brush against a bat is a cause for concern then?
On the bare skin, it is a cause for concern. The thing we know about bats is that they don't like humans for the most part, and they tend to avoid us. So it's unusual to have contact with a bat. It's unusual for bats to be active during the day, which was the case in this tragic case where the contact was outside during the day, and that's unusual for bats. They tend to be nocturnal animals, and those may be signs that there's something wrong with the bat, that they may be sick or they may have rabies. And that's why it's so important, even when the contact seems to be minimal, to clean the area thoroughly and to seek medical attention, because the vaccine that we can give early on after unexposure is protective from this serious disease.
Now, do you do that as a wide spectrum vaccine, or do you test a patient first to see if they actually need it?
Yeah, so no, there is no test early on. If somebody has an exposure, you get the vaccine to prevent you from actually developing any of the symptoms, allowing the virus to spread in the nervous system. So the vaccine stimulates your own immune system to be able to fight off and prevent any of the symptoms from starting. Once symptoms start with rabies, it's near universally fatal. There's only been a single case of somebody, once they've had symptoms, who's actually recovered from the disease.
So concerning. And also, I guess it's concerning for you as a health official, because if a person has a symptom, they might think, for example, taking an ibuprofen might deal with the pain, or if they just rest a bit, they'll get over the symptoms that they're experiencing. So really underlining how important it is to get to a medical professional, I guess.
Absolutely, and even before we even think about symptoms, because it can be months or weeks later, as we said, if you've had an exposure that is concerning, and in BC, that really is an exposure to bats, where you've had direct contact with the bat, either on the mucous membranes or on the direct skin contact, then you need to talk to a medical professional. We can do a risk assessment with you, help you understand whether it's a risky contact or not, and provide you with that vaccine.